Welcome to Nurses with Voices, the podcast where we amplify the voices of nurses everywhere. I'm your host, Dr. Lendra James, DNP RN, and I am thrilled to go on this podcast journey with you. Through this podcast, we aim to educate, empower, and inspire nurses at every stage of their careers. Whether you're a novice nurse navigating the challenges of bedside care, an experienced clinician looking to advance in your field, or dreaming of becoming a nurse entrepreneur, Nurses with Voices is here for you. Together, we'll explore the triumphs, struggles, and countless opportunities that come with being a nurse. So tune in, subscribe, and let your voice be heard, because here at Nurses with Voices, every nurse has a story worth sharing, and every nurse voice deserves to be amplified. Welcome back to another episode of Nurses with Voices. I'm your host, Dr. Lendra James, DNP RN, and today we have Alvionna Brewster. So Alvionna has been a registered nurse for almost 2 decades, and with a distinguished career specializing in cardiovascular care, health maintenance, and preventable medicine. She has a master's degree in nursing education and is not only an international speaker, an author, and an educator, but she is also a pioneering business consultant. Alvionna is the founder and CEO of Black Nurse Entrepreneurs, the premier organization dedicated to networking, empowering, and encouraging entrepreneurship among Black nurses. And her passion to, or should I say, for the success of nurses and patient education and the advancement of African Americans really shines through everything that she does, especially with her Black nurse entrepreneur community. So Alvionna, without further ado, I just want to really welcome you to the show and just really dive into your journey, your insights, and just your vision for the future of nursing.
Thank you. I appreciate the opportunity and I look forward to an awesome conversation.
What inspired you to start Black Nurse Entrepreneurs, and how this organization is making a difference in the lives of Black nurses today?
Sure. So around 2012, I started dabbling into entrepreneurship a little bit. I was working at the hospital. I was burnout, tired, stressed. And my initial entrepreneurial journey started with crafting. So I had a crafting business. I would work my shift. I would go to the craft store and come home and make my crafts and then sell them. And so it started with a hobby that turned into a passion that turned into an actual purpose. And so around 2015, there were a lot of nursing groups kind of popping up on social media. And I was in a few. And one thing that I noticed was, first of all, I had never seen Black nurses in this light, because it wasn't uncommon for me to work at a hospital system and there may be one or two of us here and there, right? And so social media provided an environment where we all could get together and kind of see the differences that Black nurses, I honestly I had never seen a DNP at that time, right? I knew that there was PhD, but I didn't know DNP existed. And then I saw these nurses that had CPR or home care or home health and things like that. And I was like, wait a minute, these nurses are similar to me. They like entrepreneurship and business like I do, but that post would disappear, or the admin would say, you can't post that in our group or whatever. And I'm like, wait a minute, I wanted to talk to them. I wanted more information. And so God spoke to me about, hey, why don't you create your own group, a safe place for Black nurses to get together and house just brilliance, be able to motivate, encourage, and inspire one another. My goal was, first of all, I don't want to pay for all these classes and things everybody's trying to get me to pay for. So maybe I'll get us together and we can exchange information, and then I'll learn some of this stuff on my own for free, right? That's what I was thinking. That's pure transparency. And so what happened was I started inboxing people and I started saying, hey, I saw that you were interested in entrepreneurship, or I saw you had a business, and I would love for you to come and join my new group that I'm forming. And so that really is what started it. And my goal was to really, and I literally ran it for free for like four to 5 years, just me by myself, utilizing it as a hobby and being able to connect people. And so many people got a lot of quick success, because it was a target audience. So people who sell scrubs came in and they were able to advertise and they were able to help other people in the scrub business. And then before you know it, people were inboxing me like, oh my gosh, this group is wonderful. First of all, we didn't even know some of these businesses existed. Second of all, people would say, I was able to sell out my course, or I was able to make cross the $1 million mark with your connections. You know, I was connecting a lot of people because I felt like if I could get new people, people who had no clue about business, if I could connect them with people who had been in business for years, then we were on to something, right? So I did a lot of connecting. And then the other thing for me was I really felt like this was my lane to be able to motivate and encourage people and to create generational wealth for their legacies, right? And so I started really watching that manifest before my eyes. It's like, wow, I'm changing the trajectory of what nursing looks like right now. And people are coming to me and they're meeting me at events and things. And they're like, we're so appreciative for what you've done for us. We didn't know this existed. And now I have a such and such business, or I'm an author now. And it's all because I got into your group and I saw what was possible. So the funny part about it was when I first started B&E, I actually didn't really have a true business. My crafting business was really exchanging money for a hobby, right? I had to learn about business and grow as an entrepreneur myself within the community. So I always encourage people to follow their passion, their dream, because you never know how God will bless you on the back end of it, right? And so really that was the catalyst. And that's brings us to where we are today, literally.
That is amazing. That's amazing. I mean, in your experience, like what do you think are some of the biggest challenges that Black nurses face in the healthcare industry, and how we can collectively work towards, I guess, overcoming those challenges?
Sure. I think the same exact challenges that we face in day to day life boils over into healthcare. Sometimes we don't necessarily feel totally appreciated for our expertise and our knowledge. A lot of us have a lot of letters behind our name, but we may, the letters and the expertise and knowledge may not be reflected in the positions that we're in. Sometimes we feel that I honestly feel like sometimes we don't feel like we can be as open and as vocal as we would like to be for fear of retaliation or for fear of, oh, you're just being angry, or, we don't appreciate your what you're saying type of thing. And so sometimes I think that when we go to work, our intentions are good. Most nurses that I work with are trying to truly go there to serve the clients, but sometimes when we walk in, as soon as we clock in, it's almost a battle. It's like we are fighting a battle of taking care of this patient and making sure they don't die, but also proving that we are worthy to be here, that we are knowledgeable enough and skilled enough, and that we know what we're talking about. I have almost 20 years of experience at this point. I know a little bit about starting this IV, and to be micromanaged or to feel belittled, sometimes is the thing that we face. So how do we get over these things? I don't know that I have fully the complete answer to that because, again, it's reflective of what we're going through in normal society. And this has been going on for years. But I think this, right? I think first and foremost, we lean on the awesome and amazing power of God. That's first and foremost, right? Um, I believe that we surround ourselves with like minded people. Okay. I believe that we do not get scared and afraid, even when we are being challenged. I think it is important for us to still be strong and still be vocal about the things that we know are right. And I've gotten in lots of good trouble in the past because I became very vocal about the things that I felt would put my patient's safety in jeopardy or potentially our license and things like that. And so I've gotten in lots of very good trouble, and I'm unapologetic about it because at the end of the day, I'm there to try to protect this patient's life. One thing I will say too is I believe because healthcare is stressful in itself.
Mhm.
It's stressful. I mean, we are catching people at their most vulnerable state. So that comes with a level of stress, right? People are vulnerable, people are scared. And then there's a lot of pressure to that because we got to make sure that this person survives and gets to go home. So there's a lot of pressure in that. And I honestly believe that healthcare could stand to provide healthcare providers as well as nurses with a level of mental health. I think that we deserve some mental health care for free, you know? I really do. And so I think that we can't sit back and wait on the healthcare system to do that. It's going to be up to us to provide ourselves with self care and mental health. I think that we need to get in places where we can effect policy changes. And then I also believe that entrepreneurship is a way that we can still practice nursing, have the autonomy to do that, and really create impact and change beyond the four walls of a hospital. That's what I love about entrepreneurship because I still get to be a nurse, but my impact far extends the four walls of someone's hospital. And that is it's my heart. That's my heart right there.
And you're just, I feel like you're like a woman after my own heart. I swear, I swear, because you're speaking my language completely, and I hear everything that you're saying. And I really hope, and I'm sure they are, the listeners are really taking in what you're saying, because everything you said was right on point, especially with the piece of, that micromanaging, or the um, doing something outside of that traditional setting that's going to
Yeah.
help with your mental health. And because mental health in nursing, when we talk about burnout, when we talk about the overwhelm, it's real. It really is. And, when we start talking about staffing, like that's a whole different, conversation within itself. But there's a lot of overwhelm, there's a lot of burnout in nursing. And one of the things that I completely agree with is organizations do have to start offering some type of wellness to their nurses, so that their nurses so we can start segue into nurses feeling more valued, nurses feeling more appreciated, and feeling like my organization is doing something to help with my mental health. And a lot of nurses are not feeling that.
Right. And I think to piggyback off of that is I always tell the patients, help me to be able to better care for you. Because you are with you 100% of the time. I'm just meeting you right now. And so even though I have a level of expertise, I don't know you. And so you have to help me to better care for you. So on the flip side of that, hospitals, you guys have got to help us to better care for your clients. Hospital systems are a business, and they hire nurses and other healthcare providers to help them to run the business, right? So put things in place that will enable me to help you to better care for these clients that we have, right?
Right, right, right. Exactly, exactly. Well, with your background in cardiovascular care and preventive medicine, what key strategies do you recommend for patients to better manage their own health and chronic diseases?
First off, I want to emphasize prevention because, again, healthcare as a whole doesn't really emphasize prevention. We're very reactive. Nurses tend to be proactive because we're taught, we want to avoid these certain things as a part of our diagnosis, right? Let's avoid bed sores. Let's avoid malnutrition. Let's avoid falls. So we tend to be proactive, but healthcare is reactive. And so that kind of boils over into our patients. We tell them to come to the hospital when this has happened, but we don't put enough emphasis on preventative medicine. And so I would really encourage your clients and listeners to understand that prevention is way cheaper and way easier than treatment. Now, yes, when you do need treatment, then seek treatment. Don't wait to the last minute, because I've had some folks to tell me, I've never been to the hospital. They're 75 years old. They've never been to the doctor, never been to the hospital, and now it's too late. Now we got quadruple bypass on our hands when that could have been prevented years ago, right? I also remind people that you are your own biggest advocate. You must learn all that you can about your body, your diagnoses, and you must also ask questions. And even, like, for instance, medications, sometimes patients will just pop medicines because the doctor told me to. And yes, the doctor tends to be the expert, but do you truly understand why you're taking it? What are the things that you need to look out for? Do you really understand? Because sometimes we go to the pharmacy and we just pick up pills and just start using them. But have you done a little research? Is this even the right pill? Because every once in a while, the pharmacy does make a mistake and will give you something wrong. So it's the proactive piece that I want my patients to understand is first and foremost. Is being really knowledgeable about yourself, being proactive, being your own biggest advocate, bringing your family into it, because no, oftentimes a diagnosis is not just about the person, it becomes a family thing. And oftentimes patients can do a lot better when they have a team of people, a support system around them. You know, my people would come in, I would have a male, a 55-year-old male that just had a major, massive heart attack, and that male is the breadwinner. So now the family becomes affected because there's a money situation, there's a health situation. Now we have to change how the family eats, how the family goes about doing certain things. There may be an emotional aspect to that, right? And so prevention is key, but proactiveness, education, those things are key. Being accountable is key, and just trying to live the best that we possibly can. I used to tell my patients in cardiac rehab, because people don't understand. They say I did everything right. I ate correctly, I exercised, I had all my screenings, and then how did I have this heart attack? And I said, well, medicine is a practice. We're constantly practicing, we're constantly learning new things. And one of the major things that I want people to understand is we don't know everything. We're still learning every day. There's new data coming out every day. And it's just like a person getting into their vehicle and putting on their seatbelt and following the speed limit and braking when they're supposed to. Sometimes things happen. And hopefully, you've done the preventative measures to try to limit the amount of damage that's done should you get in an accident. So it's the same with your health. You try to do these things to limit how badly, we don't want you to have a massive heart attack if we can keep from it, right? But it doesn't mean that we're bulletproof. And that's why I say you still have to be proactive. You still need to try to do your preventative measures. But screenings and things like that are so super important because oftentimes we can catch things in the early stage before it becomes a major issue.
Because prevention is something that I talk with my clients about all the time, and that's really key. And to your point, and I'm sure you've heard this, over and over again in the hospitals. We call it now sick care, right? As opposed to healthcare. It's really sick care. It's about, in using your words, we do a lot of reactive treatment as opposed to doing the preventative care or the proactive treatments that we really should be, providing that promotion of health and well-being. And we a lot of times don't do that. And I love that a lot of nurses are getting into wellness now, because it really gives the opportunity for the community to be involved in their self-care and advocate for themselves. And whether it's, IV hydration, whether it's massage therapy, whether it's hormonal therapy, right? Like they don't think about that. There's just so many treatments out here now that are really focused on people just taking and advocating for their own self-care. And I just love that. I love that they're doing that.
Yes, for sure.
What are some common barriers that you see that prevents nurses from pursuing that entrepreneurship, right? And how do you help them to overcome these obstacles? And I ask this because we're so knowledgeable as nurses, and there are a lot of nurses who are really taking the reins and taking back their careers and using their knowledge and their expertise and starting businesses, or doing something outside of the traditional setting. But then there's also nurses who have those blocks, right? And they have those challenges and those obstacles. And how do you help them overcome that?
It's a huge mindset issue, right? And it's not an issue, it's a challenge. It's a mindset challenge. And it's also a challenge of proximity. I think because, and this is one of the reasons why I love our communities, because you get to be close to people who do nursing differently. You get to see what that looks like, right? Our mindset, we have to, first of all, entrepreneurship and employment, the mindset that it takes to do entrepreneurship is totally different than your employee mindset. It's easy to clock in and fall into somebody else's structure, do that one job and go home. Entrepreneurship takes a whole different mindset. And that type of mindset really requires a lot of work consistently to kind of switch the gear, right? And so, because of that, first of all, we're not even taught entrepreneurship in nursing school. Now, some of the programs now are starting to kind of introduce it, but when I went to school, that wasn't even a thing, right? I think healthcare in itself has got to kind of catch up to this new level of care. But it's fine if they don't, because we are taking kind of the reins to do that. Part of its mindset. I literally, before I hopped on here with you, I literally saw a post in a group. It's a travel nursing group. And a lady in the group said something about nurse entrepreneurship changed my mindset on. She made a post about how she's able to make a lot of money really quickly, and that the $50 an hour maybe nursing salary no longer seems to be so exciting because I can make a lot more money doing a lot less work and doing what I still love to do as a nurse entrepreneur, right? And so, of course, that post is going nuts because people are like, how? Show me, teach me, tell me, let me know. Well, of course, I'm like, I can show you the ways. I can tell you, right? But oftentimes people just don't even know what's even possible. And it goes back to proximity. You got to get around, you got to get outside of the nursing community of which you see at the hospital. You got to get out of the break room. You got to get out of around the corner, the boardrooms and stuff like that. You got to come and get into some different communities that will show you that nursing is done completely different. They'll show you how nurses are able to get 6-figure and 7-figure speaking engagements or consulting contracts or government contracts. We have plenty of people in our community that have had 6 and 7-figure corporate and government contracts doing vaccinations or delivering dry ice with the vaccinations to make sure that they were safe during COVID. Like, you know what I mean? Easy work, utilizing our skill set and knowledge as a nurse, but people don't know that because they're not in those environments. So part of my job is to show you what's possible. If I can bring you out of the four walls of that hospital system and put you in a community of like-minded people and show you what's possible, then all of a sudden, what seemed to be impossible now becomes possible. And also what it does is it helps to stretch your mindset, right? It's very hard when you get around people that make in a day or a month what you made in a year. When you start getting around people and they're doing it legitimately with a legal, legitimate business, when you get around people like that, it starts to stretch you. It's a little hard to go back because once you're stretched, right? So my goal is to help people to break through those mindset barriers of, I don't know any nurse entrepreneurs, or that doesn't sound legal. Like one lady in the comments said, that sounds like an MLM bait. I've been doing B&E for 9 years now. I haven't sold one single MLM product. I know it's possible. And if you don't look at my own journey, I have plenty of people that can show you through consulting, through Airbnb, through truck businesses, staffing companies, LVN schools. They're able to create generational wealth and health even for their families and communities, still be a nurse, still do what they love to do, and not have to do it in fear, ridicule, a glass ceiling, got to break through this glass ceiling, and all these other things. So it's really about showing people what's possible. It's about helping to kind of nurture their mindset. That can't be done overnight. We literally are breaking down years and years and years of systematic thoughts, generational thoughts, things that our parents passed down to us about money, about credit, about taxes, about business. All those things we have to kind of deconstruct and reconstruct in a different way. And so I have to spend some time with nurses that are interested in business or maybe not even know anything about business and just kind of show them what's possible invite them into the community, invite them to have open and honest conversations, transparent conversations about what nurse entrepreneurship looks like. It's not for the faint at heart. It may be equally as difficult as and challenging as nursing was for me, but there's something very unique and special about running your own business. It's challenging, but it's unique. And I would ask anybody to take a step back, because people often think that nursing is kind of sort of the easy way out because it's the bird in the hand, right? People say, I work X amount of shifts and I expect to make X amount of money, which is true-ish in most cases. But I always remind them that anytime someone can control your time off or your salary, or when you eat, when you use the restroom, your vacation time, and anything in between, then do you really have control? You don't. It's a pseudo sense of security. Now, one thing about it that I'd like to say is I've been a nurse for a good amount of time, and I have paid my dues at the hospital and other places. It's not me hating on that system. It's not me bashing it. I believe that we have to have healthcare providers, point blank, period. But we do also have to start to learn and embrace different ways to be able to take care of our communities. And that's one of the things that I would also encourage people who are interested in entrepreneurship or just getting in it is, what are the things that truly break your heart? Because more than likely you have something within you that can help to like you said, I have a wellness business. So people within your community are able to come to a safe place. They don't have to go to the hospital. They don't have to wait for hours to be seen.
Right.
Come to a safe place and receive care from somebody in the community that looks like them, that goes and shops at the same places that they do, that goes to the same church, probably kids attend the same school and things like that, right? And so we're able to create that type of change in our communities. But sometimes we got to get past the roadblock of, I don't think I can do that. That ain't for me, right? Mm-hmm. So that's what I would say about that.
Absolutely, absolutely. Well, what you've said a lot that is just so, it's refreshing. It really truly is. It's always refreshing for me to hear, other nurses, in business or otherwise speak this way. So it truly, truly is refreshing to say it. And I want to ask, like, what message would you like to share to our listeners who are feeling just, overwhelmed and undervalued in their career, and especially in this current healthcare climate?
First off, I would like to tell them that they're not alone. I've been there. I was burnout 6 months out of school. I had a $7,500 contract, sign-on bonus, rather, 2-year $7,500 sign-on bonus, and I tried to break that joker every day. And really, it's by the grace of God that I didn't break it. I finished my 2 years out, but it set up a trajectory for me of burnout. I gained a lot of weight. I was depressed, and it made me bitter. It made me nasty. It made me not even know who I was. And I can almost guarantee you that there's somebody listening that is there, that, the ones that are sitting in the car crying before going to work, mm-hmm. or crying in the bathroom, mm-hmm. or crying on the way home, or calling in. I want you to understand that you're not alone. That's first and foremost. I want you to, I think one of the biggest things I wish I would have done is I wish I would have gone into something differently or changed up. I got into a place where I felt emotionally trapped. And I stayed in positions for far past their expiration date. That milk was stale, okay? I should have thrown that milk out years ago. And I wish I would have, right? I wish I would have really, truly understood my value as a nurse and that I could move around. Another thing that I did was two things. One was I was so burnt out and so tired that I did not invest enough time into continuing learning, continuing education stuff. I met my requirements that I needed for my job and for my state licensure, but I didn't spend enough time really learning more and more stuff, right? But on the flip side of that, what I did do was I went back. I started as an ADN. I went to BSN. I went to MSN. So I climbed that ladder, right? And I did it because of what I thought would happen, that it would open up a different door or change the trajectory, or it would make me feel more fulfilled, right? What it did was it gave me some more letters behind my name. It gave me $1 or $2 extra here and there. It gave me a potential supervisory position that I did for about 11 months and decided that was not a good idea. And then it gave me more debt, a little bit more. I utilized their tuition reimbursement, so not too bad, right? So what did it really do for me? In other words, like us as nurses, we get all these fancy titles and certifications and things behind our names, but at what cost? So I would challenge us to start thinking outside of the box and what else we can do. Do we really want doctorates and MPs and all that? Because a lot of people will get in it because they think that it's going to help them to get away from the bedside or get away from the burnout, when your heart may not be in that. So I really challenge us to think about it before we dive into it. I'm not saying don't do it. I'm saying to make sure that that's your purpose and that's what you really want to do, right? I wanted to go back for MSN school, not because the hospital made me, but because I truly wanted a master's degree and I love to teach. And that's why I did it. But this is the trick of it. When I graduated with my master's in nursing education, the general consensus was, well, what school are you going to teach at? Or what hospital position are you going to get, right? And I said, and at that time I had B&E. I had B&E for like 4 years. And I said, if I get a education position that I like, I may take it. But my passion is educating nurses and nurse entrepreneurship. And so I would encourage people to follow the passion. You got to figure out what the passion is and follow the passion, because when you get into the actual passion of things, I think that you get to a place where you can do it day in and day out and it doesn't matter. And I had to recognize that I love doing nursing, but this is my passion, is to do nurse entrepreneurship. So I would encourage people to figure out what that is and what that looks like for them. And don't allow anybody to tell you, just because you are a nurse practitioner, then you have to work at the clinic seeing all these patients. No, I have nurse practitioners that have scrub businesses. They may go and work a PRN shift here and there, and then they have scrub business. And they get fulfillment through serving the community that way. I have people that have DMPs and they may teach online part-time, and then they over here creating apps to help other nurses with their career. Figure out what the passion looks like. And sometimes it looks a little different than what you thought, right? And be okay with those pivots and those differences in trajectory. It's okay. And I think that nurses need to understand that we are the prize. Yes. We're the prize. We're the prize. There's not a lot of hospitals that will survive without us. So I think it's time for us to band together and to stand up instead of beating up on each other. I think it's time for us to band together and really stand up for the advancement of healthcare and really be unapologetic about our safety, that overwhelm and that burnout that we experience. We need to be unapologetic about getting help and trying to create a better environment and atmosphere for that. I don't like that it has become normalized. Like, well, this is what you signed up for. No, I didn't. I did not. I signed up to come and take care of people, but I did not sign up for that to be at my expense of my health, safety, and well-being. So I would encourage your listeners, those of you who are burnout, who are overworked, you're tired, understand you're not alone, that you do have options, that it's okay for you to become unapologetic about your safety, health, and well-being. Seek other options. Don't wait too late. Don't wait until you're bitter and miserable. Don't wait too late. I waited too late. And when I 2020, I walked away from full-time nursing and went into full-time entrepreneurship. And there was a period where I did not have a job or any income coming in. And that was in the heart of COVID. People were, whew, it was a mess. It was a mess, right? I had no income coming in. I was not working as a nurse for the first time in my entire career. And I was at the most peace I had ever been in my life by just walking away and taking a step back and refocusing on nurse entrepreneurship. So I
Right.
encourage people to do what they need to do, what they have to do in order to become better. Prayers, meditation, whatever your higher power is, you seek that higher power. Your family, friends, people that you need around you that are true to you, surround yourself with those people. Do not surround yourself with Debbie Downers because misery loves company.
So
And I'm telling you from experience, I became that person. I
mm,
became that person. A lot of people don't believe it. They're like, you're so outgoing, you're so friendly, you're so sweet. I became so bitter and tired and worn out
yeah.
that I had to walk away. But thank God that He blessed me with something else on the other side of it, right?
Right.
And so that would be my prayer for each one of your listeners is that God will bless you with whatever that passion is for you and that calling is for you. And it may look a little different than what we think nursing should look like, but that's okay.
That's okay.
It's okay.
That's it. And I think that's it right there. That's the powerful statement right there. It may look a little different, but that's okay because like you said, we've been systematically programmed to think otherwise, but I definitely can relate to the need to walk away because that was my story too. Like I actually 2021, I will never forget was when I just said enough was enough.
Mhm.
And you get to that point, and so many people out there, they're either at that point or I've met a lot of nurses who they've gotten to that point. I actually recently made a post on LinkedIn about burnout, and the comments has been just, yes, that was me. I had to take time out. I had to walk away. I had to, but they were able to, and just by doing that, just by walking away, taking time for yourself and advocating for yourself, doing that self awareness, they've been able to rebirth themselves, so to speak. And now they're doing nurse coaching, or now they're entering nursing in some other way. So it's definitely possible. We just have to be able to see the forest past the trees, so to
Yes,
speak, right?
for
And
sure.
just
For sure.
really have that belief, not only in yourself, but to your point, that higher power, whatever your higher power is, whatever your belief system is, you have to believe and then believe in yourself. And then that's what's going to really help you just to um, really start to rehabilitate,
Hmm.
yourself and getting yourself to a different way of thinking, a different way of living, because ultimately we all want to be happy, right? We want to be
Exactly.
happy. We want to be good for ourselves. We want to be good for our families, our husbands, our kids. And we can't do that if we're living in a constant state of, burnout or just feeling depressed or, whatever it's going to, it comes in many forms. It
Yep.
really, really does. So
So
thank you so much for sharing your story today. Oh my gosh, I love this. I love this. How can people find you? How can we find you if we want, if the person, I know anyone who's listening, they're like, oh, I need to talk to her.
I love to talk. Okay. Um, I am at Black Nurse Entrepreneurs across every platform. You can DM me on Facebook, I don't mind, or any of the other platforms, I don't mind. I'm very approachable. Our website is blacknurseentrepreneurs.org. You can reach out there as well. And anytime you guys see me at these events, I'm very visible at events and conferences and things like that. Do not hesitate to come up and say hi and talk to me because I really truly love to connect and network with the people. And so when you see me either virtually or in person, be sure to reach out. And like I say, Alvionna Brewster, you can see my page. I have a page on social media, IG, LinkedIn, and Facebook too. So either way, Alvionna Brewster or Black Nurse Entrepreneurs, either way, you can reach out to me there.
Any events, upcoming events that you want to share?
I don't have anything right now. I don't have any in-person events. I do have a potential masterclass is coming up next week.
Okay.
Potentially. Next week is our 9th year. July
Hi.
25th is
So
nine years. And
amazing.
so what I want you guys to do is go follow our social because you'll see the announcements and then you
Okay.
can sign up. Okay. So that's what I want. But it's
So,
going to be geared more towards the people who are, I call it Business Essentials Masterclass. And those are people who are interested in business, kind of on the fence, like, I don't know about this. I try to really help people understand some of the things that I wish I would have known pretty early in
mhm,
my business.
mhm.
And so I do this master class to really help them. And then that also, leads into me helping them one-on-one with coaching and stuff like that. So yeah,
Nice,
we'll
nice.
post it.
Definitely, definitely. All right. Well, we have to definitely stay in touch because I have some upcoming events that I should probably speak with you about.
Okay.
So I love it. All right. Well, thanks again. All right, guys. Until next time, make sure you stay educated, stay inspired, and stay empowered.